Several years ago, I had a patient come in and see me for the very first time. She told me she knew something was wrong, but she had avoided coming in because her last primary care provider had told her that her symptoms were purely just from being morbidly obese and that they couldn't really solve that for her. She told me that they really didn't even get a chance to look at what was happening on her left upper thigh, but she felt that it was conveyed to her that once she lost weight, she could come back and they could talk more. That was 2 years earlier. She hadn't been to a medical provider for this issue in 2 years. She had been afraid to engage in healthcare and didn't trust that she would be heard. And this friend of mine ended up having a massive ulcer on her thigh that was so infected, unfortunately, she eventually lost that leg. Now, I don't share this story to criticize another healthcare provider. Healthcare is incredibly complex, and every provider is doing their very best in an imperfect system. That much I know. I share it because it reveals something. It reveals two words to me that we rarely talk about in healthcare, and we need to start talking about. Bigger than the healthcare itself: trust and fear. Not fear of illness necessarily, although that can exist, but fear of being invulnerable, fear of being exposed, the fear of not being heard, the fear of maybe the person sitting across from you doesn't actually see you as a human being, but more as another chart. That fear has a powerful effect. It influences whether people seek care when they should in the future. It influences whether they follow the guidance that they're given, and it absolutely influences whether they trust the people responsible for their care. That experience forced me to confront something that we rarely talk about in healthcare. Trust in healthcare has been underdesigned. I've spent more than 15 years in healthcare, and over time, I began noticing something that I couldn't ignore anymore. The long-term outcome of many patient visits was being shaped before the provider ever walked into the room, before the first question was ever asked, before the diagnosis was ever explained. Those patients had already made a determination. They were already deciding something very important. Do I trust this place? Do I trust these people? Do they actually care about me? And those questions determine engagement. And engagement determines outcomes.